How does flu cause hyperglycemia in diabetics? Imagine catching the flu and suddenly feeling worse than usual, especially if you have diabetes. The flu can cause blood sugar levels to spike, and understanding how this happens helps manage the risks. When someone with diabetes gets the flu, their body reacts with a strong immune response. This response releases chemicals called cytokines that cause inflammation throughout the body. This inflammation triggers the releases of stress hormones like cortisol, adrenaline, and glucagon. These hormones tell the liver to produce more glucose, which raises blood sugar levels. At the same time, they make insulin less effective, so the body can't lower blood sugar as well as it normally would. This combination leads to higher blood sugar levels during illness. The flu virus can also directly interfere with how insulin works, especially in the liver. Research shows that influenza infection can reduce the activity of important molecules involved in insulin signaling, making cells less responsive to insulin. When insulin doesn't work properly, glucose isn't taken up by cells effectively, and the liver keeps making more glucose, pushing blood sugar even higher. Additionally, the flu disrupts normal metabolism of sugars and fats. It decreases the activity of the tricarboxylic acid cycle, a key pathway for energy production, which causes cells to produce less energy and alters how nutrients are processed. This imbalance can worsen insulin resistance and make blood sugar control more difficult. High blood sugar itself can make flu symptoms worse. Elevated glucose levels can damage the lung tissues and increase inflammation, creating a more severe infection. High glucose in airway secretions can also help the virus replicate faster in lung cells, which can lead to a more intense immune response. This heightened inflammation further raises stress hormones, creating a cycle of worsening hyperglycemia. Moreover, high blood sugar impairs immune functions like neutrophil activity and the ability of the body to fight infections. This immune impairment can prolong the illness, leading to more inflammation and sustained high blood sugar levels. People with diabetes often experience fluctuations in their blood sugar levels, known as glycemic variability. During the flu, these fluctuations tend to increase, partly because of oxidative stress and inflammation. This makes managing blood sugar more challenging and can lead to complications. Overall, the flu causes hyperglycemia in diabetics mainly through a combination of systemic inflammation, stress hormone releases, direct interference with insulin signaling, and metabolic disruption. The high glucose environment can also promote more viral replication and worsen immune function, creating a cycle that makes both the infection and blood sugar control more difficult. That's why it's so important for people with diabetes to keep their blood sugar as stable as possible before and during illness. Always consult healthcare professionals for personalized advice and management strategies to reduce the risk of complications during flu season.